Hi everyone, and welcome to this presentation, which will be about knee joint disease in dogs with focus on cranial cruciate ligament disease. And I will start by presenting myself. My name is Karolina Engdahl and I took my veterinary degree at the Swedish University of Agricultural Sciences in 2016. And I started my PhD education the year after, which is about the knee joint diseases in dogs and with focus on epidemiology of these diseases, which means evaluation of risk factors for disease, for example. And my project is financed by Agria Pet Insurande. I also work part-time as an emergency veterinarian at the small animal clinic at the University Animal Hospital in Uppsala. So, the knee joint will be our focus in this presentation. You can see it here on the picture in the red circle. And this joint involves many different anatomical structures. Here you see the bones of the joints from the side. You can see femur, tibia and fibula. And you can also see the kneecap, which is also called patella. In addition, you can see the cruciate ligaments. There are two, one cranial and one caudal, and they are located in the knee joint. And they are responsible for the stability of the joint. And the knee joint can be affected by many different diseases. Here you see some of the most common one. We have cruciate ligament disease, which is also called cruciate ligament rupture. And we will talk a bit more about this disease soon. We also have patellar luxation, and this is a condition where the patella is moved, it's luxated from its original position, and this can cause varying degree of lameness in the affected dogs. And this condition mainly affects breeds of small sizes. There are also many other conditions such as osteochondrosis, osteoarthritis, which is also called arthrosis, collateral ligament injury, meniscal injury, and fractures, for example. But cruciate ligament disease is generally reported as the most common condition, and that will be our focus for today. So, cruciate ligament rupture can be caused by acute trauma during activity, but sometimes the dog is suddenly lame and the owner hasn't noticed that anything happened to the dog. And it's usually the cranial of the two cruciate ligaments that ruptures, and it can rupture partially or total. And as I said, the cruciate ligaments stabilize the joint. So when the ligament ruptures, the joint becomes unstable. You can see here on the picture that tibia has an abnormal motion compared to femur in a cranial direction. And historically, cruciate ligament rupture was considered to be caused by trauma. For example, if a dog was hit by a car. But the picture has changed during the last years. And now we know that a degenerative process, osteoarthritis or osteoarthrosis, is usually ongoing in the affected knee joint at the time when the ligament ruptures. And this degenerative process is associated with chronic inflammation and pain. But the cause of this degenerative process is not known. Multiple factors are thought to contribute to development of cruciate ligament rupture. You can see some of them here on the picture. We have anatomy, environmental factors, immune-mediated disease, which can affect joints in dogs, as well as other parts of the body, and also genetic factors. And even though the background of the disease is a bit unclear, we know that often several factors are needed in order for cruciate ligament rupture to develop in a dog. And cruciate ligament rupture can result in different types of clinical signs, such as lameness, which can be acute or chronic. And some dogs are just slightly lame, while others have a non-weight-bearing lameness. And the joint can be swollen and painful at palpation. And the affected hind limb can have a decreased muscle mass if the disease has been going on for a while, if it's chronic. And sometimes both legs are affected, sometimes at the same time, or the first leg is affected and then a few weeks or months or years after the second leg becomes affected. But if both legs are affected at the same time, the dog can be unable to walk at all. And at the clinic, the vet usually palpates the affected joint and tries to elicit stifle joint instability. The severity of the lameness is also commonly evaluated in these dogs. And sedative medication is often used because pain can cause muscle contraction, and this can make it hard to evaluate stifle joint instability if the dog is awake. Radiographs are also usually taken, even though the cruciate ligaments can't be seen on radiographs. They are taken to rule out differential diagnoses such as fractures, for example, and the vet can also evaluate signs of concurrent osteoarthrosis, which involves, for example, increased amount of synovial fluid in the joint. And cruciate ligament rupture can be treated in many different ways. There are actually over 60 variations of surgical procedures reported for treatment of these conditions. And I will go through some of the most common ones today. And all techniques are aiming at stabilizing this stifle joint in various different ways, because the ligament itself has really poor healing ability. So the joint needs to be stabilized in other ways when the ligament is ruptured. To the left, you can see the lateral fibrotibial suture, where a suture is placed outside the joint capsule to stabilize the joint. You can see the suture there on the picture. We also have TPLO and TTA, and these are examples of osteotomy procedures. And in these procedures, the angles of the bones in the joint are altered by sewing and stabilizing the fragments with implants. And this also stabilizes the joint. And it's common to perform arthrotomy or arthroscopy at time of treatment. And this means that the surgeon inspects the joint and evaluates the degree of cruciate ligament rupture, as well as the degree of degenerative changes in the joint, and if the dog is affected by concurrent meniscal injury, which is really common in dogs with cruciate ligament rupture. And studies have shown that TPLO generally produces the best treatment outcome, even though the outcome for all these surgical procedures generally is reported as successful. And cruciate ligament rupture can also be treated non-surgically, also called conservative treatment. And this includes restricted activity during the first weeks after the injury, physiotherapy, and treatment with painkillers, as well as weight loss if it's indicated. And there are only a few studies that have evaluated the treatment outcome after conservative treatment of cruciate ligament rupture. But the method is generally only used in small dogs. So, why are cranial cruciate ligament ruptures so important? Well, it's quite a common disease. The estimates vary a little, but somewhere around 0.23 to 2.55% of all dogs are affected by this condition. And it also quite frequently results in chronic pain because, as I said, osteoarthrosis is usually present in the joint when the ligament ruptures. And this is a degenerative, chronic, low-grade inflammation associated with varying degree of pain, and it progresses in the affected joint regardless of treatment method, so we have no cure for this. And one study reported that about a third of dogs surgically treated for cruciate ligament rupture had signs of chronic pain a few years after the treatment. And in addition, the surgical procedures used for treatment of cruciate ligament rupture are complicated and associated with high costs. And as an example, dog owners in the US spent $1.32 billion on treatment of cruciate ligament rupture in their dogs during 2003. And this number has probably increased a lot since that, because it was almost 20 years ago. So as a summary, the disease is quite common. It frequently, or at least quite frequently, results in chronic pain in the affected dogs, which of course affects the welfare of these individuals. And it's also quite costly for the animal owners. So the aims of my project are to evaluate the prevalence of knee joint disease, which means to evaluate how common the different diseases are here in Sweden. And we also want to evaluate risk factors for knee joint disease in general, but specifically for cruciate ligament rupture, as this is generally the most common knee joint disorder. We want to know which dogs that are affected, dogs of a specific breed or age group, is it female or male dogs, and we also want to evaluate the prognosis for these dogs. How are they doing a few years after the treatment of the injury? So the project is separated into two parts. In one we use data from Agria Pet Insurande, and in the other we use data from medical records from dogs treated at 2 university animal hospitals. And I will start by going through some results from the first part of the project. So in this part we use data from Agria Pet Insurande, and we had data on about 600,000 dogs that were insured between 2011 to 2016. And we had information about the age, breed and sex of these dogs, as well as about diagnoses that they were affected of during this time period, given that they were reimbursed by Agria. And I just want to add that it wasn't possible for us to connect information to a specific individual, because the data was anonymized when we received it. We wanted to know, as I said, which dogs that were affected by knee joint disease in general and also by cruciate ligament rupture. So, over to some results. In total, 9,624 dogs were affected by knee joint disease, and of these, 4,167 dogs were affected by cruciate ligament rupture. And some dogs were actually euthanized due to these conditions. 769 dogs were euthanized due to knee joint disease, and of these 447 were euthanized due to cruciate ligament rupture. Females had a slightly increased risk of both knee joint disease in general and also cruciate ligament rupture. And dogs were generally affected when they were middle-aged, even though the time of disease onset varied between different knee joint disorders. And here you can see the most common diagnoses. On first place we have cruciate ligament rupture, and on the second place patellar luxation. But on the third place we have a group of diagnoses involving unspecific signs from the knee joint, such as joint pain, for example. And this can indicate that it can be quite hard to find a specific diagnosis right away. Maybe the dog needs to be examined by an orthopedic veterinarian in order to find the right diagnosis, for example. Or maybe it needs sedation in order to relax, so the vet can really palpate the joint and evaluate instability if the dog is affected by cruciate ligament rupture, for example. This can also represent acute injuries that resolve and where no specific diagnosis could be found. They resolve without further treatment. And on the 4th place we have degenerative joint disease, and on 5th place joint inflammation. So here are some common dog breeds, and some common large dog breeds. We have the German Shepherd dog, the Golden Retriever, the Rottweiler, and the Labrador Retriever. And we will go through the distribution of the different knee joint diseases in these breeds. And in the top bar you can see cruciate ligament rupture, which was really common in these large breeds. It was the most common knee joint diagnosis in all of these breeds except for the German Shepherd dog. But you can also see that unspecific pain was also common in these breeds, the blue bar, as well as osteoarthrosis. On the other hand, patelloluxation was really uncommon in these breeds. The purple bar, you can see that there were hardly any individuals affected by this condition in these large breed dogs. We will now look at some other common breeds, but small or medium-sized breeds. And on the top row you can see Yorkshire Terrier, Chihuahua, French Bulldog, and miniature and toy poodles. And here patelloluxation was much more common. You can see that the purple bar is much higher in these breeds. So it looks a bit different compared to the larger breeds. Cruciate ligament rupture was also common in some small breeds or medium-sized breeds, such as in the Jack Russell Terrier, Bichon Frise, and Staffordshire Bull Terrier, for example. So patelloluxation mainly seems to affect small dogs, while cruciate ligament rupture affects dogs of all sizes. And here you can see the breeds that had highest risk of cruciate ligament rupture, and you can see the number of times the risk was increased compared to all other breeds in the database. And something interesting here is that 8 of the 10 breeds on this list were of Molosser type. And these breeds are generally stocky, very muscular, robust. And we don't know if it's due to the anatomy of these dogs or if there's some genetic factor that affects the structure or function of the ligament that causes this increased risk. So this will need more research. Some dogs also had higher risk for euthanasia due to cruciate ligament rupture. You can see them here. And all these breeds are large or giant. And on first place we have the Dogo de Bordeaux, which has 30 times increased risk of euthanasia due to cruciate ligament rupture compared to all other breeds included in the database. We also found an association between age at diagnosis and size of the breed. Larger breeds were generally diagnosed at a younger age compared to smaller breeds, which were diagnosed at an older age. And this is likely due to the fact that the degenerative process that I talked about earlier starts at a younger age in these large breeds. But we don't know the reason for this yet. So that was the results from the first part of the study. And now I will talk a little about the studies based on medical records from 2 hospitals. In the first study, we wanted to evaluate complications after surgical treatment of cranial cruciate ligament rupture. We wanted to evaluate how common postoperative complications were and which dogs that were of high risk of such complications. But first, I'm going to tell you about complications. What is a complication? Well, it is something unexpected that has a negative consequence, such as a bleeding, a wound infection, or problems with the surgical implant. And in this study, we wanted to evaluate severe complications, which involves complications that require medical or surgical treatment in order to resolve, or complications that caused death or euthanasia or permanent unacceptable function. So we used data from 2 university animal hospitals between 2011 to 2016. We had the University Animal Hospital in Uppsala and also in Oslo. And we reviewed the medical records and collected information about the dogs, and we also did telephone interviews with the dog owners in case information was missing in the medical records. And this study included 255 dogs that were treated with these 3 different surgical procedures, which I told you about before. And we found that 1 of 4 knee joints were affected by a severe complication after the surgery, which is quite a high number. And the most common complications were related to the surgical implants, such as failure of the implant in some way, or wound infections. So which dogs had increased or decreased risk of such complications? Well, we could see that dogs treated with TPLO had lowest risk of severe complications, while younger dogs had increased risk and heavier dogs had increased risk. And it can be hard to restrict the activity in the postoperative period in a young and very active dog, which could explain this increased risk in the younger dogs. And in heavier dogs, there's a higher mechanical load on the knee joint, but it can also be hard to restrict the activity in the postoperative period in a heavy dog because it's not as easy to carry a heavy dog upstairs, for example, compared to a small dog, which could explain this increased risk. And I also just want to add that it's really complex. The decision of which treatment that is chosen for a dog is really complex, and it involves a lot of different factors and should be individually chosen for each dog. So these were the results from this study. It doesn't mean that these results apply to all dogs in all situations, because the risk factors can vary between different hospitals, between different surgeons, etc. But this was the result of our study. We also wanted to evaluate survival after cruciate ligament rupture, and we wanted to know if it varies between different treatments. We used data from the same hospitals during the same time period, but this study included 333 dogs treated in 3 different treatment groups. Here we had TPLO and TTA in one group, together with dogs treated with MMP, which is a procedure which is quite similar to the TTA procedure. And these procedures are called osteotomies, and were grouped together because they are quite similar, all 3 of these procedures. And we also had a group with dogs treated with lateral fibrotibial suture, the LFS procedure, and also a group of conservatively treated dogs treated without any surgery. We could see a few years after the treatment, when we did a follow-up, that almost every 5th dog was euthanized due to cruciate ligament rupture. And the most common reasons for this was persistent lameness or cruciate ligament rupture on the other hind limb. So which dogs had increased or decreased risk of cruciate ligament related euthanasia? Well, we could see that dogs treated with TPLO, TTA or MMP had decreased risk of euthanasia compared to conservatively treated dogs. And we can see that the risk increased in older dogs, in heavier dogs, and in dogs with other concurrent musculoskeletal diseases. And I just want to add that based on these results, we can't say that the treatment outcome was worse after conservative treatment compared to the other treatment groups. We can suspect it, but we need more research, because it might have been that dog owners with limited economy chose conservative treatment for their dogs, and that they couldn't afford to proceed with further treatments such as follow-up veterinary visits or visits to do physiotherapy, etc., and that they chose euthanasia instead. So we need more studies to evaluate the results of conservative treatment after cruciate ligament rupture. I also have some other studies ongoing in the project. One is about the quality of life in dogs with cruciate ligament rupture, because we have evaluated complications and survival, but we also want to know how the dogs are doing, the dogs that are still alive, at follow-up. So we have distributed a quality of life questionnaire to the dog owners of the dogs that were still alive a few years after the injury, and we are analyzing the results from this questionnaire right now. We also want to know if it's possible to assess the prognosis for a dog by taking radiographs at the time of diagnosis of cruciate ligament rupture and assess the severity of osteoarthrosis. So that's also an ongoing study in the project. We will also do a study about patellar luxation in dogs in the same way as we did for cruciate ligament rupture based on data from Agria Pet Insurande. And finally, we have also done a study about cruciate ligament rupture in cats, because cats are affected as, but not as commonly as dogs. And this study is already published. I won't talk about it here today, but you can find it if you want to read more about this study. And if you want to know more about the results that I've told you about today, they are all published in different journals. You can see the titles of the articles here and the journal names, and these articles will be included in my doctoral thesis. I also want to say that I haven't done everything by myself. I've had a fantastic supervisor group, and my main supervisor is Ulf Emanuelsson, and my co-supervisors are Annika Bergström, Jeanette Hansson, and Odd Höglund. And the hospital-based studies were performed in collaboration with my former PhD colleague Gudrun Seberg-Boge, who was working at the Norwegian University of Life Sciences before she defended her thesis a few years ago. And now I just want to thank you so much for listening to this presentation. And here is my email address if you have questions. I can't answer questions about specific dogs, specific cases, but if you have general questions about knee joint disease or cruciate ligament rupture in dogs, you're very welcome to send me an email. Thank you so much.